Well, congratulations to this powerful symbol of collaboration and continuity, setting the example. Thank you for that, and best of luck to Portugal for your chairmanship. Now we will dive even deeper into the essence of this conference, exploring truly what the future holds for healthcare. Now, some speakers do this by explaining the future. Other speakers throw you right into it, and somehow you land on your feet on the other side, and you're so much smarter for it. Our next speaker tends to do the latter, so fasten your seatbelt, get ready. And I just want to briefly introduce him. He's a Stanford and Harvard-trained physician-scientist. He's an investor. He's an innovator. He's been working at the intersection of medicine, AI, biotech, and emerging technologies for decades. He's no stranger to Maastricht. Was there anyone here in 2010-11 at TEDx Maastricht? A few hands, yes. So you observed the beginnings of this friendship. And with that, I want to welcome and still give a few minutes to Dr. Daniel Kraft. He's the CEO of Nextmed Health. He also annually hosts a conference in San Diego on what's now, near, and next. Who's been to that? Anyone been to San Diego? Yes, we have a few hands here in the front. Clearly, there's a growing international collaboration between Maastricht and this conference. And now it looks like our speaker, Dr. Daniel Kraft, is ready to go. So with that, I hand over the stage to you. And ladies and gentlemen, be ready for a ride into the future.
Thank you very much. Fantastic. It's such an honor and pleasure to be back in the Netherlands and in Maastricht. And thank you to Tom and Lucienne and others who helped get me here. As was mentioned, I was here 15 years ago for the most amazing TEDx experience of my life, certainly changed my life, where the theme of my talk was, medicine's future. There's an app for that. It was the early days, 15 years ago. There was only about 15,000 apps. Today there's over 400,000 or so health and medically related apps. At the time, that was about a $10,000 genome to sequence. Now it's about a $80 genome to sequence. AI was in the form of IBM Watson, and not quite perfect. Now we have hundreds of FDA-cleared AI applications. So the world has certainly accelerated and changed since then, but we still have a lot of work to do. And here in Maastricht, and in the Netherlands, you have such an amazing mindset for change and catalyzing the future of healthcare. Of course, we're navigating interesting times. There's some challenges, there's some wins, there's some good things happening and bad things happening. But we have the opportunity to think about our mindsets moving forward. I love this quote. The pessimist complains about the wind, the optimist expects it to change, the leader adjusts the sail. And the good news is we have some incredible new winds at our back that enable us to reshape the future of health and medicine around the planet. And of course, I made those images with AI, like we're all cheating with AI and GPT, and you of course can now text something and make an image. To just show you how incredible that is, I just typed this last night.
The future of health and medicine is coming faster than you think. Let's create it together.
Now, these technologies still aren't perfect. Let's see if you can see the problem in this one. I brought a little friend in. Now, he's an AI, but let's see if you can see it's not perfect there. Yeah, subtle, but not there. Of course, I can arrive in Maastricht in new ways,
Good morning, Maastricht. With technology taking off this fast, your doctor might arrive by jet before the ambulance even gets the call. And if they land as smoothly as this, healthcare's future is looking pretty bright and pretty airborne.
Yeah, pretty airborne. So anyway, it's fun to do those sorts of things. But, these things are moving quickly, and of course, for all of us, many of us are clinicians. AI is moving so quickly, it's better than most of us at passing the medical boards, even as of a couple of years ago. We know that patients aren't going to Dr. Google anymore. They go to Dr. GPT and often find the problem that was not able to be found by their medical specialists. And of course, that world's moving. As of a couple weeks ago, OpenAI announced ChatGPT Health. Not perfect, still launching, but we've only 3 years since GPT launched into the world. So really transformative about how we're going to practice care. AI chatbots defeat doctors at diagnosing illness. Well, maybe soon it will be malpractice not to have used the AI in making the diagnosis. So these things are challenging and often coming faster than we think. There's Moore's law, but there's also a Mars law. Sometimes we overestimate what will happen in 2 years, underestimate what might happen in a decade. And just another taste of that, you might remember the video in 2023 of someone typed in, someone eating some spaghetti. The differences between then and now are vast. And that's only been 3 years. What might the world of AI and generative AI LLMs look like 3 years from now? So a little bit of frame setting about where we were with this and where it's potentially coming next. Some dystopian qualities and some positive ones. Now, of course, these tools are still young. They're not perfect. They still have biases, mistakes, hallucinations. There's also some cognitive challenges. Sam Altman, the founder of OpenAI, said, GPT is like an e-bike for your mind. A lot of people riding bicycles in the Netherlands, at least where I come from, a lot of the kids are riding e-bikes, which is great, but what if your kids never learn how to ride a regular bike or never develop their biking muscles, or a medical student never learns how to develop a differential diagnosis without the help of the AI, right? Or we've seen the new evidence of de-skilling. When GI doctors are using AI to find lesions and they stop using the AI, they've lost their capabilities. But I think we can overall use these technologies to upskill all of us. And like many of you, I'm an optimist. I don't think about generative AI, I think about generative health, this new future where these agents and new elements will match us based on our old age, our culture, our understanding, our healthcare journey destinations. They can be anywhere, anytime, and distribute healthcare in our pockets to any population at low cost with incredible intelligence. So these LLMs are going to become personal health large language models. Google's already doing that, leveraging your genomic and other data to give you personal health coaching, giving you not just AI, but contextual intelligence to know exactly who and where you are. The fact that I'm jet lagged might mean I might not be catalyzed to do my workout this morning. So big picture, our goal, I think this entire meeting, is to take us to a more intelligent future, more digitally enabled, a little more data-driven, more proactive, preventative, and really to make health and medicine more accessible and democratized around the planet, taking us from where we are now in most settings, sick care, to a near future that's true health care. Not just the near future, we need to go from where we are now, sick care, to health care, to true health creation, from episodic and continuous to predictive and preemptive, from physical and virtual to phygital and ambient. We'll touch on some of the art of the possible that's already here today and what will be coming next. But in order to appreciate the future, sometimes you have to go a bit back to the future. I trained at Stanford and at Mass General Hospital. When I go back to visit Mass General Hospital, which I did a few weeks ago, and I visit the ward where I was a doctor in the late 1990s, it's pretty much frozen in time, still using fax machines to communicate to the pharmacy, still handing out paper forms. When I had a cardiac study done at Stanford last year, I got my results on a DVD. I don't even own a DVD player anymore. So we sometimes have old architecture, right? But bottom line, these architectures are accelerating. And it's not just AI and robotics and nanotech and genomics, it's how we put them together. And that was actually the theme of what I talked about in Maastricht in 2011. It's this super convergence of technologies getting faster, cheaper, smaller, even more so in the last 10, 15 years. And those create these new fields that didn't exist when I was a Stanford medical student. Some of them didn't exist 15 years ago, from LLMs to low-cost gene sequencing to robotic surgery to continuous monitoring to CRISPR to mixed reality. These are the new tool sets innovators, entrepreneurs, academics can use to create this future of health and medicine. So I had an interesting lens on this. I've been the chair of medicine for something called Singularity University, built a program called Exponential Medicine, which is now called Nextmed Health, which many of you have joined. Last year we had some amazing folks from Eric Topol, the dean came in, to Larry Brilliant, and many others in the room. Many Dutchies have come, thanks to Lucienne and crew over the last decade. And the magic is having both incredible faculty, and some of them you're going to see here, Lucienne and Jack Kreinler and Dr. Larry Brilliant, but kind of community and mindset. We've had, for example, the head of innovation from NHS join us for many years, who shares this old quote: "The difficulty lies not in the new ideas, but in escaping from the old ones." So a lot of you have new ideas, but sometimes our institutions and our health systems and our colleagues are stuck in the old ways. So it's more about mindset. It's also about community, the amazing friends and people that you bring along the way that help us bring us to the future of health and medicine. So hopefully many of you will join with ICT in our next Nextmeds in San Francisco and beyond. So that's a bit of a frame set for how do we reimagine healthcare, not just thinking about today, but again, thinking about the next 5, 10, and 15 years. And many of you are entrepreneurs. It's an incredible time to catalyze and invest in healthcare. I have a small venture fund. The companies we're investing in are at that convergence of technologies, often not just in the industrial side of healthcare, but often in the self-health or the self-care side. Many of you have maybe gotten your own direct-to-consumer GLP-1s or had your labs done on certain platforms or had your own scans done. That's now becoming empowered in the hands of the consumer, not waiting to go to the clinician. We're seeing, of course, now this advent of many thinking about personal wellness or longevity, which many of us like to reframe as health span, because we want to, of course, increase our health span and shrink our sick spans. There's a lot of noise in the space, a lot of snake oil, so we need to be careful about what we're looking at, but the science is starting to get exciting. And yes, we can cure many mice and make them live longer, but the art of the science is taking our new tools, including some existing ones that might be longevity agents, to extend our healthy health spans. We'll have a lot of conversations about that over the few days. There's even an X Prize, which I've been involved in, $100 million to help catalyze stopping and reversing aging. So it's an interesting time. We may, 15 years from now, really be in a field of rejuvenative medicine where we can maybe stop and even reverse aging. But I think we want to really focus on the health span and the what's next realm over the next 10, 15 years. I wrote the opening article for National Geographic a few years ago. They retitled it 12 Innovations That Will Revolutionize the Future of Medicine. It's not about any one innovation. In fact, the technologies are a bit of a so what if you don't align the incentives. Because in most parts of the world, particularly the United States, we don't practice evidence-based medicine, we practice reimbursement-based medicine. You get the care that you pay for, and in too many settings, we're paying for the sick care, not for the wellness and the prevention. That's starting to shift, but it's all about incentives going forward. And it's also about leveraging and understanding where technology is heading. Genomics is something we're all quite familiar with. I'm sure many of you have been sequenced, the price of sequencing dropping at twice the rate of Moore's Law, down to about an $80 genome on the way to a $10 genome. And that means we can hopefully integrate that into our clinical workflows. When a patient shows up, you'll know their pharmacogenomics, and can you pick the right statin or the right blood pressure meds. We're going to understand almost every disease at its genomic level. It's not just type 2 diabetes or autism or cancer. We're going to understand it at its genetic molecular level and use that specifically to prevent, diagnose, and treat that disease. That's not just for metabolic diseases, but even brain diseases. Mental health elements can be highly personalized using multi-omic data. And we're starting to see the evidence of bringing the data together. As Genomics England is doing, they sequence many folks in the UK and many folks in Europe, and we can bring the insights from the clinic to the lab and back and forth as we become data donors and learn together. Now, of course, in this era, it's not just about reading DNA, it's the era of writing DNA, synthetic biology. CRISPR has exploded in the scene in the last 10, 15 years to the point now where my friend climbed Mount Kilimanjaro with his friend Jimmy. But Jimmy, until 5 years ago, had sickle cell disease. He had a bone marrow transplant with CRISPR-based therapy. He's now cured. He can climb Mount Kilimanjaro. That's just a taste of the art of the possible with gene therapy. We're going to move that upstream to treating diseases before the patient actually has the effects of that disease. In vivo gene editing to knock out genes for high cholesterol. Just published, and still preclinical, is to do in vivo gene therapy to make your own GLP-1 engines. You'll never have to take an injection or a med. Still in early clinical evolution. That's a taste of where things were going to go, very upstream. And of course, now with AI helping us design drugs and personalized vaccines and beyond, it's really going to speed up that evolution. And I think the next decade we'll see this evolution of true personalized vaccines to prevent cancer and neurological diseases and beyond. So a combined ecosystem of AI meets data meets synthetic biology. And it's not just, of course, about your genome. We're now in the era of exponentially less expensive proteomics. The exposome, where you've lived, it can be measured. Your sociome, your metabolome from an over-the-counter continuous glucose monitor. Your microbiome, which plays such a role in the health of your gut, your brain, your heart, and beyond. The immunome, which is becoming decipherable. So these omics are all interesting, but it's when you put them together, this idea of multimodal health, the integration of all those data layers is going to give us the era of not just a buzzword, but a true sort of digital twin for each of us, for our patients and populations. It might be for their heart, it might be for a particular disease, but to make sense of that data and integrate that at N of 1, not N of average. And even back to the aging element, there's different ageotypes. We all age differently. To understand those elements and be able to intervene for prevention, wellness, and beyond. So, digital twin, good news, your digital twin's in excellent shape. Now, if we could only get you two to sync up. Of course, that cartoon was just generated by AI as well. It can have a sense of humor. So, you don't need to wait for the magic pill, right? Still do those things that are most evident to help your health span, longevity, exercise, movement, sleep, social connection, sense of purpose, and more will be able to make precision elements to those to really guide that going forward. So the world's moving exponentially, right? We've all experienced that with Moore's Law. The Cray supercomputer now fits on your smartwatch or your smart ring. All these analog technologies that used to be on your desk have now essentially dissolved and become, in many cases, democratized and demonetized and able to be distributed at the press of a button. Quantum computing is coming fast and furious. That's going to have a huge impact on everything from developing drugs to understanding our digital biomarkers at scale. And of course, with these new tools, we can now enter this agentic and avatar age. You can create an avatar to look like anybody in any form. You can create superheroes like Lucien in new ways. If you want to make the Lego version of him, you can make a Lego version. You can, of course, animate them.
The future of health starts now, transforming healthcare with nurses and tech. Join the revolution.
Yes, revolution, and nurses included, of course. And I don't think AI can ever replace a nurse. This is a horrible framing. NVIDIA wants to replace nurses. But we can use AI and agentics to help upskill nurses, let them do the human part, and let the AI nurse make the phone calls and do the reminders. So that's coming in interesting realms. And of course, in this agentic age, you all remember 10 years ago, we had our, still kind of kludgy Google Glass that wasn't, a very great consumer hit, but these are now becoming consumerized in new forms, and it's going to enable us as clinicians and as humans to see our healthcare data in new forms. It might be helping a surgeon see through the back and do a procedure guided by the lessons from thousands of back surgeries before. It can give us an augmented reality view, not a view of today when you look in the mirror, but you of tomorrow if you're doing your exercise and your P90X and your push-ups. Or you of tomorrow if you keep having pastries and donuts for breakfast, right? I love my European Danishes. Like 1 Danish, 100 Danishes later. So I will think about one, right? Or if you have a friend or colleague who smokes and you can show them before smoking and after smoking on their face. That's a powerful lens for behavior change, one of the hardest technologies. Or if your kids spend too much time on social media, another dangerous element. So we can take lessons from augmented virtual reality and blend that from other fields. I'm a pilot. I've been a pilot since college. I flew in the Air National Guard as an officer and flight surgeon in a fighter squadron. We use heads-up display as a form of augmented reality in the fighter cockpit. It gives us situational awareness. You know where your wingman is, who's shooting at you, what the altitude is. It can also give you a good warning if you're flying too low, you're about to hit a mountain. It will beep at you normally and say, pull up, pull up. So imagine these new tools help us with our behavior change. We're wearing our next generation glasses or contact lenses. It doesn't just show us our breakfast of now, it shows us a little more insight and it gives us a little nudge to move a little faster. Pull up before we have that unhealthy meal. Now back to aviation for a second. When I learned to fly 30-something years ago, Cessna 150, round analog dials, paper maps, charts with pencils. I have an airplane now about the same size, but it has a glass cockpit, it has GPS touchscreen, gives you real-time information, situational awareness about the traffic, weather, all these other elements come together. That doesn't that's kind of the dashboard we need to bring into health and medicine, not just for the fighter pilot or the regular pilot, but into our integrated care. We're seeing other lessons like the heads-up display and the air traffic control come into hospital systems, like at Chiba, where they can help understand the flow of patients in and out, just like airports guide the gates and openings. So lots of connections can happen there. And then, of course, our pilots train on flight simulators. We're teaching the next generation of clinicians to leverage simulation, not to see one, do one, teach one, but to see one and simulate it to get it right. So that kind of convergence from fields is coming together to improve medical education. Or the black box in many airplanes is coming to the operating room so we can measure millions of surgeries and guide clinicians, because 50% of surgeons are below average, to be the top percentage surgeons going forward. Robotics, of course, is in the air and is getting pretty incredible. It's starting to become more autonomous. I don't think we're yet ready to have autonomous robotic surgery, but we're going to see more and more of these elements be guided and trained by humans and become done semi-autonomously, sort of like we've all experienced with self-driving cars, whether we like Elon Musk or beyond. We're going to see these tools go from sort of regular driving to partial assist to full assist, and again, that can really help democratize health access and interventions around the world, because at many places it's not a question of will AI replace your doctor or surgeon. There just is no doctor or surgeon available. What about diagnostics? We really want to pick up diseases at stage 0, not stage 3 or stage 4. We have many new tools leveraging AI to, in fact, look at my brain and give it color coding. You can go and get a full body scan done today in now 30 minutes, read by the AI radiologist, which can give you really deep insights. And not quite ready for prime time, but could be the part of the future of all of our physical exam, where we go to the corner pharmacy and in 10 minutes get a full body scan read by the AI radiologist that might really help determine and be proactive for preventing many diseases and picking them up early. Of course, our biggest element for prevention is our behaviors. Our behaviors drive most, or our bad behaviors, drive most of our downstream chronic problems. And now, if you go back 15 years, when I was here in Maastricht before, the Fitbit had just launched a year or two before. There were about 200,000 sold in the first couple of years. I'm sure many of you have some sort of wearable or otherable. I've got 2 rings on, my Apple Watch, my Whoop, and others I won't show you. But what's interesting about these wearables is they're moving from sort of consumer to health and medical. They can measure almost every element of our physiology and our behavior, right? The next generation Apple Watches, Fitbits, Garmins, they can start to do real-time blood pressure, maybe soon real-time blood sugar. What are you going to do with your patients when it's streaming your blood pressure and blood sugar 24/7? Challenges and opportunities. There are now sweatables that can measure the sweat of an athlete or someone with heart disease or kidney disease. There are patches now. We're going to talk more about moving from hospital to home, where you never admit the patient to the hospital. You have a patch on that can live stream basically an intensive care unit level of data. These are on the market today. They still need to be plugged in and integrated. And then, of course, you don't need to bring any diagnostic tool. The camera now on your smartphone can do the medical selfie. It can pick up your heart rate, your blood pressure, maybe even other forms of data, eye tremor, neurologic elements, movement. All those sort of digitome elements can be used continuously to make sense and be proactive. The microphone on your smartphone, I still have my 2011 era Apple iPhone version 2. It still works. It felt magical back then, but now it feels antique. But the microphone, even on an old phone, can pick up your voice. The biomarker can pick up sounds of depression, but also screen for hypertension and diabetes. Breath is another form of biomarker that can pick up early signs of lung cancer and other diseases. There's even this idea of ingestibles, a Fitbit for your stomach, to look at your GI health. In fact, I got a chance to swallow one of these, still pretty large pills, called a PillBot. I swallow the pill on the live camera, and then there it is on the left, and then here I am steering it around in my stomach using a game
Live
controller.
from New York or live from my stomach, we have the PillBot from the addicts. Let's have a little look at my
I'm
website.
steering around with a game controller.
And when would you want to use this spec?
I'm talking to the head of GI at Mayo Clinic. So that can take basically a $15,000 procedure and make it a $500 procedure. And these insidables are going to get smaller and do interventions in new forms. So as things get smaller, more integrated, it can bring care anywhere at lower cost. Now, back to wearables for a second. Of course, the smart ring can do a pretty good job of letting me know that I'm jet lagged, right? I need some more sleep, so I'm going to work on that later. But these real-time elements from a wearable device can predict pregnancy 5 days before a home pregnancy test. Or they can be used in a public health setting to predict where there's an epidemic, or to let you know that you might have COVID or the flu a couple days early. In fact, UCSF with Aura showed that you could use these technologies to predict the titer from a vaccine booster. Or use data from a smart ring to look at, for example, high-risk pregnancy and determine when a woman is having preeclampsia or likely to have preterm delivery. So these are new biomarkers. Our future will be continuous physical exams, leveraging wearable and other forms of information. Another thing your wearable can do is tell you how good your walking is and your gait. Mobility is a new vital sign. You can measure that in a whole new set of ways just with a simple camera and AI, and give you a bit of a mobility score, because as we want to live long, healthy lives, how well you get around is important. And here's my mobility score. It wasn't so great. I need to stretch more. But will be augmented, not just if you're a paraplegic, with exoskeletons, exoboots, to help you when you're 90 climb Mount Kilimanjaro as if you're 60. And these are going to become more and more consumerized and help us move in interesting ways. Then, of course, we go back to our old technology, food as medicine. Of course, we can quantify that now today as well. Metabolic health, over-the-counter continuous glucose monitors. We can measure our inputs, and we can start to measure our outputs. Consumer-based designs are here in our bathrooms, whether you want to use them or not, can give us a new lens into our health information. And when you put that together, your genome, your microbiome, your metabolome, we can truly drive precision nutrition to optimize our health spans, to manage disease, and bring better health around the planet. Now, where does this take us in 10 years? We're going to always, whether we like it or not, there's definitely privacy issues, be online with our digitome, our digital exhaust. We'll enter this era of predictalytics. Imagine a bit of a FICO score for your health, not just looking at your labs, but your financial health, your social health, your sexual health, your community altogether. We'll be entering the era of the true sort of check engine light for the body, not just the check engine light for your car, but integrating multiple signals proactively. In fact, That future's already here. If you have an Apple Watch, there's an app called Vitals. It can look at your own personal baseline and show, as it did on me when I had the flu last year, that you're getting a little out of whack a couple days before you get sick. Or it might be showing that your resting heart rate's normally 55, it's gone up to 75. Maybe there's something cardiovascular going on. So the early era of being able to integrate that with AI and coach agents, as some of the consumer health elements are doing today, to give us true interfaces, again, match each of us based on our age, culture, language, personality, and beyond, and give us that information in real time. So if you remember the movie Minority Report, we may soon be being told we have disease before we even know we have it. I'd ask you where it hurts, but your wearables have already booked you an MRI at 3:15. So the dystopian future. So diagnostics, of course, doesn't always have to happen in the four walls of the clinic or the hospital. These are some of my digital tools in some of my pockets, some of my digital bag that can be part of a community health worker in rural Rwanda. These democratize access, right? During the pandemic, I helped run an X Prize for fast, frequent, cheap, and easy COVID tests because they weren't available in 2020, 21. Those sorts of solutions aren't just good for infectious disease, but non-infectious diseases and are coming again into our homes, something that the COVID pandemic catalyzed, even to the point now where the FDA cleared home pap smears with a home-based device for women, which is going to be a huge game changer. So again, thinking differently about where healthcare happens from hospital to home and beyond. And of course, a bit of the theme we've already talked about today is connecting all those dots. It used to be called mobile health or connected health. It's really this realm of digital and AI-enabled health, right? We're not just prescribing a drug or a device, we're prescribing a digiceutical, an app that might help treat your child with ADHD or help someone quit smoking or manage their diabetes. We're taking all these new forms of data that came from our wearables, many of us are data geeks and quantified selfers, and shifting it to quantified health, where that data is going to flow to you as a clinician to enable proactive prevention, health span, to diagnose disease early based on those other digital multimodal data sets, and to have therapy, whether it's hypertension or a cancer, and be much more integrated going over time. So that begs the question for many of us who are clinicians, what skills do you need to learn? If you're a medical student starting medical school today, you're not going to finish your training until 2032, 2033. How do you teach not just good bedside manner, but good website manner? How do you think about who do you choose for medical school or nursing or pharmacy or physical therapy? The future of the workforce, do they learn how to vibe code and AI, or do they need to learn organic chemistry? Bigger questions we can discuss over the next few days, but important to think about where do we ride the exponential curve with education going forward? And how do we make these tools available to the clinicians and patients of today? There's thousands of these solutions already out there, hundreds of thousands of apps and wearables. I had trouble keeping track, so about 3 years ago, I put together a platform. It's a free platform called digital.health. That's the website. If you go to digital.health, we have over now 5,000 digital health solutions, and you might be interested in diagnostic platforms, like you want to track an EKG, so you can look at platforms like this and prescribe that to your patient, or put that in your digital formulary, or put that in your digital prescription pad. Or you might want to be managing a patient with type 2 diabetes, not with a drug, but look for solutions that leverage diet and nutrition, like VertaHealth, that can reverse diabetes with AI and coaching. So these are just a few of the tools already out there. They're not always leveraged. I would encourage all of you to try these solutions, even when they're not perfect. And I think the future might be hopefully an easy button for digital health, where you can enter yourself or your patients on digital health journeys to bring them where they need to go. Now, all this sounds great, but we know that none of us really want more data, right? We're overwhelmed with the regular data, the lab Chem 20, the EKG. We need to think about not just data, which is still often very siloed between government resources and genomics and pharma and telemedicine, and it's all siloed and often misaligned on connecting. We don't want to create more data. We want to create more new knowledge, new insights, and not just create that data and publish it in New England Journal and wait 17 years to become standard of care, but to accelerate that implementation science to go from 17 years to 17 minutes so that it can be used at the bedside or at the website. And to make our prescriptions smarter. Just last month, Utah became the first state to allow AI to approve prescription refills. When will AI be making not just the refills, but the prescription decisions? And when will we expect that to happen before our clinicians do that as well? So interesting times. And in order to accelerate that knowledge set, I think we need to become better data donors between health systems, between individuals. I love the model of Google Maps or Waze. Here's a map of Rome built just by driver data. What if we could have a bit of a Waze or Google Map for health, not just in the Netherlands and beyond, but connecting each of us on our own personal healthcare journeys and colliding that data, making it safe and transparent, but also anonymized so that we can build better personalized healthcare journeys. And it's starting to happen, right? If you've ever been in a self-driving car, if you come to San Francisco, Ubers are now being replaced by Waymos. And I imagine, here, take a look. If self-driving cars were more like healthcare.
Good morning, Daniel.
Morning. All right, let's ride. Take me to the health pod.
Destination set. 12 minutes.
Everything looks good. If cars can drive themselves, maybe checkups should too. Guess they just did.
So comes on demand, has transparent pricing, adapts to the weather, to the traffic, and soon we might be chasing these opportunities if they're not chasing us.
Hey, wait, I'm still here. Hold up. I need my checkup. Just a quick blood pressure, that's all. Proceeding to next appointment.
Yeah.
Oh, come on.
So always pauses and exits about
Faster
technology.
than you think. If only I could catch it.
So a fun taste of that, where that goes. So where that can bring us, big picture, is a future that's going from intermittent and reactive sick care to a future that's continuous, proactive, anytime, anywhere, arguably at lower costs, and making health access more equitable and distributable. It means we're going to go from these virtual visits to agentic visits. The agent is going to know you, talk to you in your language. And I can already do that today. I'm helping my friend, a cancer patient named Steve Brown, build a platform called QWise. I can upload my medical record, and I can talk to any number of agents, and it can tell me what to do with my cholesterol and my other lab data. And this was catalyzed when Steve had his own healthcare journey. It took months to be diagnosed. He just uploaded his data, and here's what happened.
Haley, can you take a look at my chart? Because something's going on, and I'm trying to figure it out. Just give me some feedback here.
Steve, I'm noticing a pattern in your labs that warrants attention. Your mild anemia alongside significantly elevated ferritin, low immunoglobulins, IgA and IgM, and hypogammaglobulinemia suggest potential bone marrow or immune system dysfunction. This could explain your fatigue and weight loss.
And indeed, he had multiple myeloma. He then built his own virtual tumor board and has been using that to guide his personalized oncology journey, and now building that for others. So an early taste of where this agentic element will go. And of course, that's not just for us in the West. Many of these technologies will leapfrog and are starting to happen in other places. India is a place where there's a big shortage of doctors, nurses, specialists. I'm on the board with Endo Ng of a new startup called Jivi AI, where it's basically a personal health superintelligence in your pocket. Starting in India, talks in hundreds of languages, doesn't just do triage, but also can be your health coach, your nutritionist, do your dermatology, speak to you in Ayurvedic medicine as well. And sort of these health superintelligences will become democratized around the planet. And it's not just AI that's virtual, it's become physicalized. This, AI doctor, pharmacist, and beyond sounded like science fiction, but moving very, very quickly. And many, when there's shortages, will be using these tools. They're also social. We know that health is social. We can now interact with home-based robotics. Soon they'll be picking up our socks. You can imagine a GPT-enabled dog helping someone who's lonely or separated. These will become really integrated into healthcare, particularly where there's healthcare shortages. But a major thing, of course, is that this doesn't replace the human element of care. It's not about competing or being replaced by AI. There's that famous quote, AI will replace your doctor. It's not that AI will replace your doctor, but doctors and nurses and systems that use AI will replace those who don't. We need to integrate in those co-pilots in smart, humanistic ways going forward. And I'll close with therapy. All these things are terrific, but we still need better care, and people still need to take drugs or have crutches or implants. 3D printing is something that's moved relatively quickly, and I've been thinking about how do we take the challenge of personalized medicine and precision and adherence and use 3D printing. So we've been developing a system to pick the right drugs for both prevention and therapy, and then instead of taking a pile of 10 pills, you can 3D print one that's based on you. And in telemedicine, it can be 3D printed in your corner pharmacy or eventually at home, starting with generic drugs. And so you can imagine an age where you wake up in the morning and your kitchen counter prints off your pill based on you, both for your longevity cocktail and your healthcare cocktail, to drive true precision, just-in-time care. So a bit of a taste of where that might go next. So in summary, it's a very exciting time to reimagine health and medicine here in Maastricht, the Netherlands, and beyond. It's not about any one technology. It's about how they super converge. It's how we have a mindset about going from now, near, to bringing that next faster. Not just about the technologies, but really creating a new operating system for healthcare. It's about connecting those dots in a workable system with trust, with AI maybe at its core, but integrating the workflows, the incentives to all come together to go from now, near, and bring us to this next vision that we can explore the next few days. So again, 2026 used to be the distant future. I want you to be like Wayne Gretzky, the famous hockey player, and skate to where the puck is going to be in 2036 and 15 years after that. It's not about taking incremental steps, it's about taking exponential ones. The future is already here. Many of you are creating it, just not evenly distributed. It's up to all of us here at ICT Health and beyond, not to predict that future of health, but build it for all of us here on Spaceship Earth. So with that, let's go build the future together. Thank you.
Daniel, come join me just for a quick moment.
Okay.
This was definitely a trip into the future, and you're so right that it's unevenly distributed, but it's clearly also here at the same time.
Right.
Just one question. As we talk about the future, what do you think we underestimate most as some of us might feel like we're sitting in a place where the future isn't yet quite here? What do we underestimate, and how do we overcome that?
Wow. I mean, we underestimate, again, the speed of exponentials. Just those examples of digital videos gives you a taste. I think we underestimate how consumers, how patients are so hungry for this, given that even where I live in San Francisco, it takes months to get a primary care doctor visit or specialist visit, and going to Dr. GPT is becoming the norm. And so, it used to be that your patient would show up with a print of Google printouts from the web. Now they may be more informed about that specific disease than you are as a clinician. And I think the underestimate is that, we used to live in the cognitive mind. I trained at Stanford and Mass General. I'll do it a certain way. Now we have the opportunity to crowdsource the knowledge and the insights and bring the lessons from millions of patients to the patient in front of you. And that takes a mindset shift. It used to be the clinician is the god. It used to be that you have to go to the ivory tower to unlock that data. Now it's becoming democratized quickly. And so we might underestimate how quickly some people might want to go around the old systems. And so how do we adapt to that going forward is a big, not a technology problem, but a psychology and a behavior change and a mindset challenge.
Any tips?
Any tips? Well, I would say don't wait for the future to arrive. If you have your own medical issue, there's already many startups building those solutions. Perfection is the enemy of the good. I mean, we're not going to ever have anything perfect. We know that all drugs have side effects. AI will have pluses and minuses. We still want to hold them to account, but if you see a medical challenge, maybe start piloting yourself. You have hypertension, get a connected blood pressure cuff. Start leveraging that with your own clinician. See how you might integrate that into the workflows in Maastricht or in The Hague or in Paris or beyond, because it needs us to be the catalyst and not wait for someone else to deliver it, because as humans, we want to be involved in that innovation, patients included, nurses included, healthcare systems included. It's not about dropping off the technology, but figuring out how to plug it in and let people see the art of the possible and the positivity that can bring to everyone around them.
Thank you so much, Daniel.
Danke.
Appreciate it. Appreciate it.